Hello everyone, hope you are doing good, and today we will discuss about the Norma Lateralis. In the previous classes we have discussed about the frontalis, interior of cranium. Today we will discuss about Norma Lateralis. So this is the lateral view of the skull, and today we will see the features what we are going to appreciate in the dry skull, and I request all of you to hold the dry skull in the hand in this view, in the lateralis view, so that you can understand whatever we are discussing. So when you see the norma lateralis, what are the different bones of the norma lateralis? First you will see frontal bone, parietal bone, sphenoid bone and temporal bone, and you will see following features like temporal fossa, a shallow depression on the side of the skull, then zygomatic arch, it's a bony bar, and then supramastoid crest and a nipple-like mastoid process and external acoustic meatus, and below zygomatic arch you will see a fossa called as infratemporal fossa. So these are things again we will see what we are going to discuss today. First, that is temporal fossa, and then zygomatic arch formed by both zygoma and temporal bones. It's a bony bar, bony arch you can say, and that is external acoustic meatus and supramastoid crest, continuation of zygomatic arch, then a projecting bony process, that is mastoid process behind external acoustic meatus, then one bony fossa or a irregular bony cavity, that is infratemporal fossa. So we'll study about this, and we'll take out the mandible to see where is this infratemporal fossa. You can see there this irregular bony fossa, that is infratemporal fossa. So we will see one by one. First we are going to see the temporal fossa. So what is this temporal fossa? So we will see in the definition, shape, boundaries and its contents. You can see it's a shallow depression on the side of the skull below the temporal lines and above the zygomatic arch. You can see it has superior boundary, inferior boundary, anterior and posterior boundaries, roof and floor. And when you see the floor, it is formed by the four bones that you see in this view, that is frontal, parietal, sphenoid and temporal, which are held by a suture here, the H-shaped suture. That point is called as pterion. So this pterion is also a location of anterolateral fontanelle during the development, and this pterion is clinically important because beneath this pterion there is location of these middle meningeal vessels, or you can say anterodivision of middle meningeal vessels. I think you have seen in the interior of the middle cranial fossa, lateral part, you have seen the anterodivision, groove for anterodivision of middle meningeal vessels. So it is a site of temple injury or may cause extradural hemorrhage, and this is also important to avoid during trephining of extradural hemorrhage. That is about pterion, that is the floor of this temporal fossa. Whereas the anterior boundary is formed by the zygomatic process of frontal bone and the frontal process of zygomatic, and you can see posterior surface of zygoma, frontal crest of zygoma, and from the tip you will see two temporal lines which form the superior boundary, superior and inferior temporal line. Superior temporal line fades away, inferior temporal continues as a posterior boundary and is in line with the inferior boundary formed by superior border of zygomatic arch, which will continue as supramastoid crest. So these four bones form the floor with the pterion, and these are the boundaries, whereas the roof of the temporal fossa is formed by temporal fascia, deep fascia here. And coming to the contents are one muscle, that is temporalis muscle, muscle of mastication. It takes origin from the floor of the temporal fossa. Anterior fibers are vertical, posterior fibers are horizontal. It also takes origin from the temporal fascia also, and this temporalis goes between the temporal side of the Norma Lateralis part and zygomatic arch and inserts into coronoid process of mandible. And you can see anterior fibers help in the elevation of the jaw, whereas posterior horizontal fiber help in retraction of the jaw. So that is temporalis muscle. And beneath temporalis you will see a pair of deep temporal vessels. They may be 2 or 3 in number. They have a different variant branching pattern, and these deep temporal vessels come from second part of maxillary artery. And you also see deep temporal nerves coming from the anterior division of mandibular nerve. Behind that you will see auriculotemporal nerve. The name itself says it supplies both ear and temporal part of this skull. So auriculotemporal nerve is a branch coming from the posterior division of mandibular nerve. Then coming to this zygomatic arch, as already we have discussed it, this is a bony arch formed by the temporal process of zygomatic bone and zygomatic process of temporal bone held by this suture, zygomatico-temporal suture. You can see it will continue behind as the supramastoid crust above external acoustic meatus, and this bony bar is separated by a gap from the temporal side of the skull. You can see that gap there, through which this tendon of temporalis passes. So temporalis muscle first is a content of temporal fossa, then tendon of temporalis is a content of infratemporal fossa. So you can see here, and when you see the border, upper blunt border, the zygomatic arch has a upper blunt border and a lower sharp border. Upper blunt border gives attachment to temporal fascia, which forms the roof of this temporal fossa, whereas the lower sharp margin gives attachment to the muscle called as masseter, muscle of mastication. When you clench your teeth, you can see the thickening on either side of the mandible. That is masseter, also called as zygomatico-mandibularis. Remember this, masseter is also called as zygomatico-mandibularis. It comes from zygoma, inserts to mandible. That is outer surface of the ramus of the mandible. And as you go here, when you trace the lower sharp border near the posterior part, it presents a bony process called as articular tubercle. It has 2 roots, anterior and posterior. Posterior is anteroposterior, whereas anterior root is horizontal. They form the boundaries of this mandibular fossa, which holds the head of the mandible to form only movable synovial joint of the skull, temporomandibular joint, apart from ossicles. And this zygomatic arch is important, just 4 cm above the middle of the zygomatic arch and 3.5 cm behind the frontozygomatic suture. You will see the pterion. So while doing the trephining of extradural hemorrhage, this distance is very important. So that is about zygomatic arch. And now we'll continue with the supramastoid crust. You can see the zygomatic arch above this external acoustic meatus is continuing as supramastoid crust. It is nothing but a continuation of inferior temporal line from above. From anteriorly, it is a continuation of zygomatic arch. And when you divide the bones like this, you can see the different bones you can appreciate in the Norma Lateralis view. So these are the bones here, and pterion will be there. You can see posterior inferior angle of frontal bone, anterior inferior angle of parietal bone. So this is how they join there. And now if you see the feature here, that is external acoustic meatus, you can appreciate here, above formed by the squamous part of the temporal bone, in front and below by the tympanic part of the temporal bone. You can see above, and you can say posterior superiorly squamous part, anteroinferiorly the tympanic part, whereas lateral 1/3 is cartilaginous, medial 2/3 is bony. So this is the bony part you are seeing. It has a diameter of around 2.5 centimeters. You can see just behind the mandibular fossa, you will see this entire tympanic plate here, that is forming the anterior-inferior boundary of external acoustic meatus. Just above and behind the external acoustic meatus, you will see supramastoid crest. You can see there. Then you will see a nipple-like bony projection, mastoid process. It is called as masta, means nipple. So mastoid process is that it has two surfaces, lateral and medial, and a tip. You can see here on the medial side of the mastoid process you will see a notch, that is digastric notch, for the origin of posterior belly of digastric, which forms the digastric triangle. I think we have discussed that. And just behind that tendon you will see occipital artery. It's a branch of external carotid artery, you can see there. And this mastoid process gives attachment to the muscles like sternocleidomastoid and splenius capitis, some part of semispinous capitis, which form the floor of the posterior triangle. And as you extend behind, it will continue as the superior nuchal line, that is the boundary between the head and neck, you can see. And we have discussed about this supramastoid crest, and you will see a triangle here formed by the above by the supramastoid crest, anteroinferiorly the posterior wall of external acoustic meatus, and a tangential line. Imagine a tangential line joining these two lines leads to the McEwans triangle, also called as supramastoid triangle. It is the site of ear surgeries, where we take post-auricular incision and entry into the middle ear. In case of CSOM surgeries, very important landmark for EAT surgeons, McEwans triangle. So anteroinferiorly posterior margin of external acoustic meatus, above supramastoid crest, behind tangential line joining them. Then you will see a foramina here between this projecting bone, that is styloid process and mastoid process, called as stylomastoid foramina. And stylomastoid vessels enter into it. These are the branch of posterior auricular vessels. Posterior auricular artery is a branch of external carotid, and facial nerve exits the skull via this foramina. Very important. Facial nerve comes out of the skull through this stylomastoid foramina, and in front of stylomastoid foramina you will see a sharp bony projection called as styloid process. Just in front of the mastoid process, that is styloid process, it is also a part of temporal bone. You can see how the tympanic plate end sheath sits anteriorly. This is the styloid process. It gives attachment to the 3 muscles and 2 ligaments. So totally 5 structures attached to it. Together it is called as styloid apparatus. So the 3 muscles are, first one is stylopharyngeus, coming from the anterior surface, from the medial side of the base, stylohyoid, and middle of the posterior border, that is stylo hyoid, that is, and styloglossus from the tip. You can see stylopharyngeus from the anterior border, from the tip styloglossus, and from the posterior border stylohyoid, and 2 ligaments are stylomandibular and stylohyoid. So because of this attachment, 3 muscles and 2 ligaments, it looks like a bouquet, also called as Riolan's bouquet, and it is related to the posteromedial surface of the parotid gland, the styloid process, and medially it is related to the 4 cranial nerves, 9, 10, 11, 12, this internal cavitary artery, internal jugular vein also, and quad tympani nerve is passing medial to it. So a lot of important structures are related to it, and when it is elongated abnormally, it leads to a syndrome called as Eagle's syndrome, because it may pinch on these nerves, producing dizziness, dysphagia like symptoms. That's why start process is very important. And now coming to the last part, that is last fossa, infratemporal fossa. You can see here, you can imagine it like a box having 6 surfaces. It is a irregular bony fossa here. If you just turn the skull in the basal view, you will see the roof is formed by this sphenoid bone, greater wing of sphenoid. So temporal surface of greater wing of sphenoid is forming the roof, whereas the anterior wall is formed by the posterior surface of body of maxilla. Posterior surface of body of maxilla is forming the anterior boundary here, whereas the medial boundary, you will see a plate there, a shelf like bony projection anteroposteriorly, that is, so medial boundary is formed by the lateral surface of this lateral pterygoid plate, from which the lateral pterygoid muscle takes origin. So that is the medial boundary of the temporal, this infratemporal fossa, whereas posteriorly you will see head and neck of the mandible, temporomandibular joint, whereas inferiorly and lower part of posterior it is open, whereas lateral it is formed by the medial surface of ramus of the mandible. You can say lateral boundary of the temporal infratemporal fossa. So anteriorly maxilla, and you can see here the tendon of temporalis. I told you while discussing temporalis, it takes origin in temporal fossa, but its tendon appears in infratemporal fossa. So origin is in the temporal fossa, insertion is in the infratemporal fossa. So below and behind it is open, it is not bound by any structure, some soft tissue will cover there. And coming to the communication, this infratemporal fossa communicates anteriorly with the orbit via inferior orbital fissure, whereas above it communicates with the middle cranial fossa by these 2 openings, foramen ovale, foramen spinosum. You already know what is passing through foramen ovale: male, mandibular nerve, axillary meningeal artery, lesser patellar nerve, emissary veins. Foramen spinosum, 3 M's, middle meningeal artery, vein and nerve. That is the communication with the middle cranial fossa, and it communicates medially with the pterygopalatal fossa via this pterygomaxillary fissure between the maxilla and pterygoid plate, pterygomaxillary fissure, through which the third part of maxillary artery will enter, and it communicates with temporal fossa by the gap beneath zygomatic arch that we have already seen. So these are the features of Norma Lateralis: temporal fossa, zygomatic arch, supramastoid crest, external acoustic meatus, mastoid process, styloid process, and infratemporal fossa. So these are the features. Hope you have appreciated same in your dry skull. Do follow the channel. Please subscribe and share. Thank you.